Dr. Nicholas Chronos is a distinguished cardiologist with a career spanning several decades. He also has made an impact in our Lake Oconee area through his expertise and commitment to healthcare. Dr. Chronos has established a practice here that covers a broad spectrum of medical services, including concierge medicine. Today, I have the pleasure of interviewing Dr. Nicholas Chronos. Dr. Chronos, thanks for being here.
Thank you so much for having me.
It's always good to see you.
And vice versa.
You
in
know,
your beautiful abode here.
Oh, thank you. So the very first time we met was back in 2006. I remember going to your office over at St. Joseph's.
Right, in Atlanta.
And yes, and I was waiting in the reception room, and I opened this magazine, and there you were. I was looking at your photo, and it says, Dr. Nicholas Chronos, top research cardiologist in the country. So I felt great being there. And of course, we've been friends ever since, and fast forward, here you are here at Lake Oconee making a huge impact with your practice.
Thank you very much. It was a transition from Atlanta to out here, and it's been so wonderful to be out here full time.
Yes. So Dr. Chronos, tell me a little bit about how this all came about, your practice here, and now you're here full time, and you cover a broad spectrum of medical services and concierge medicine as well.
So when I was part of St. Joe's, we would come out here and do clinic once a week, and it was fun, and obviously I saw you in Atlanta. But subsequently, I decided to transition out here in 2012 and go and develop a full-time practice. And we started small, and we grew, and we're now actually the largest multi-specialty independent practice out here at the lake. And as you know, 2 years ago, we started a concierge practice. We absorbed a previously functioning practice here in the area and have grown that as well. So we've now got gynecology, internal medicine, geriatrics, electrophysiology, and 5 wonderful nurse practitioners. And then we're growing now the concierge practice, and we've just hired a lady called Dr. Diane Peterman, who's going to be in the concierge practice, so we're growing that as well.
That's wonderful. Well, speaking of concierge medicine, tell us a little bit about the concierge medicine and what is the difference between concierge medicine and the traditional practice?
Mm-hmm. That's an interesting and quite difficult question to answer, because I think we try to treat everybody well. We try to really focus on the individual. The beauty of concierge is people on the whole who are interested in their health are more interested in access, more interested in a more in-depth relationship with their physician and healthcare providers. And one of the things that we've found over the last 2 years is those people in concierge really are committed to their health. So concierge medicine allows us the opportunity to really personalize it to an individual's specific health needs. So we have people who are well and want just an in-depth preventative type medicine. And then we have other patients, actually some surprisingly sick patients, who need much more coordination of care. We have currently 4 or 5 patients up at the Cleveland Clinic. We have 3 or 4 at Mayo and a couple at Mass General. So these people are quite sick. They need much more coordination of care than normal medicine allows, and it's a privilege to work with them on their health care.
So in terms of the Mayo Clinic and Cleveland, do you help coordinate that care for them?
Everything.
Okay.
Yeah, we are involved heavily in, first of all, the referral to the right type of specialist. Secondly, interaction with that specialist. So if a patient has to go to Cleveland, for instance, they see the experts up there, but then they come back here, but we coordinate subsequent imaging, blood tests, anything else that is needed.
Right.
Yeah, and it's gives us this ability to really be a true team around the patient, and I think that's one of the things a lot of people have valued, is lacking in the traditional form of medicine.
Dr. Chronos, with the advancement of telemedicine, how has technology affected the delivery of concierge healthcare services?
I think technology is the wave of the future. We're seeing tremendous value of these trackers, health trackers, We watch people with high blood pressure, arrhythmias, different things, and we're trying to identify both ways to better treat patients. So if you've got high blood pressure and we're following you, much better to follow you at home rather than in the clinic. You know, in the clinic, you walk in, you've got white coat syndrome, your blood pressure's through the roof. But in your own environment at home, we can much better understand what is your real blood pressure and what should we be treating. Same with arrhythmias. As you know, especially in our population out here, atrial fibrillation is a huge problem, biggest cause of stroke, and yet very difficult to find. Most people don't even know they've got it. But now with some of these incredible tracking devices, we can see that real time and understand who's at risk and then deal with that risk.
Dr. Chronos, tell me a little bit about genomics and personalized medicine.
So that is, of course, a really expanding field recently, and there are fantastic tests available beyond what is the standard, such as Gallery. Gallery can look at 72 of your genes and predict what cancers you might be at risk of in your lifetime.
Wow.
Right? So if a lady has an increased risk of breast cancer, why wouldn't one want to know that in advance? If somebody's got colorectal cancer risk, why wouldn't one? Because you can change the way we then manage those folks. So I think what you're going to see in personalized medicine is a real focus on what do your genes bring to the table and how can we understand that and then manage that. We're also seeing a huge growth in personalized medicine in cardiovascular disease. There are many risk factors beyond the traditional cholesterol that if you do the genomic testing, you can understand, and then you can modify the way we treat the patient with maybe even more aggressive forms of treatment, such as injectables versus statins and things.
So tell me a little bit about that process of genomic testing and what does it actually take?
It's surprisingly easy. It's either a swab of the inside of your mouth, it's a saliva sample, or a blood sample, and that's it.
Wow.
We don't need to biopsy anything, we don't need to. Now, of course, if you are unfortunate enough to have a cancer, then when the surgeon may take out some of the tissue, that can be sent for genomic analysis. And the key there is that you can target the therapy. So it's amazing. In the last 10 years since the human genome, things have changed dramatically. Previously, it may have cost $100,000, $1 million to sequence a human. Now it's in the $1,000 range. It's nothing.
Wow, and
So,
this is something that you actually offer.
Yeah, there's an incredible company called Gallery.
Right.
There's another company called Invite. We have all of those and we send them off. And it's really, we were introduced to that by two of our concierge patients who said, I want more than what traditional medicine can offer. I have the resources, I'd like to do it. And one was from California, and of course California is ahead of all of us. And we started investigating and finding these incredible tools exist today.
Yeah.
And it's, for us, it's not difficult to do. We just take a blood test or a saliva test, send it off, and get this incredible set of data back. And what's even better is the companies that do this also guide the clinicians to understand what to do with the data.
Well, this is really good information because I think we have a lot of people out there who probably don't realize that this is being offered in your practice.
I think that's one of our biggest challenges is we have this beautiful community here with a lot of people moving in who've come from other areas where much of this is available, but here they wouldn't even know we could do this. And yet, the great thing for us is we don't have to build a multi-million-dollar lab to do this. There are great companies that we just do the front-end piece, the swab or the blood test, send it off, and then get all the data. And then, of course, if we find we have 2 or 3 patients who have extremely rare genetic diseases. So we then will learn that and then partner with the right person at one of the major teaching hospitals. I'll give you an example. There are some conditions that, of course, can affect an individual, but can also affect their children.
Right.
So you sure would like to know if a child is at risk. And there are some incredible people at Eggleston and Boston Children's that we interact with as well.
It's fascinating. What are the latest health trends that people should be aware of today to improve their overall well-being and longevity?
So I think that we can break it down into really advanced stuff and really simple stuff. You know, diet is becoming very obvious. It's inflammation is one of the real things that we all need to look out for. And one of the keys is have a good diet. And we're very much in favor of the Mediterranean diet. There are now endless publications show that the Mediterranean diet reduces inflammation in your body. And this inflammation is not only in your joints, it's in your blood vessels. It's what causes strokes. And it's also been related to a lot of cancers. So diet is one of those things. Exercise is important. And it doesn't need to be crazy amounts of exercise. It's just a regular exercise. And we have such beautiful facilities here. Use them. I think the other things that people need to think about is mental health and reducing stress. We see these challenges around us. We all know we live in a very busy thing. Take some time out and relax a little bit.
Mental health is a big issue right now, nationally, actually globally. Yeah,
and you see it every day, sadly. College campuses everywhere. You see it in cities. And I think I've often, if there would be one thing I'd encourage people to do, is go and read a book called The Blue Zone, because it's fantastic. It's a book that was done about lifestyle. And I've often thought this, where we live, is a blue zone. There are so many of the features. People can relax, they can have good health care, they can eat well, and they can live a fulfilling life.
Well, thank you so much, Dr. Chronos, for being here. And we are so fortunate to have you in our community, and you're definitely making an impact. And we thank you so much for all you do every day. And we will let our audience know how to reach you, Dr. Nic Chronos, and his practice. And we appreciate everything that you shared with us today.
Thank you so much, Riezl, for this opportunity, this remarkable series you've got. And we're happy to help you and anybody else.
Thank you.